Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. What a journey this has been so far. Many of you have followed me for years as we shared our frustrations with invisible illness. For myself and my kids, we began with POTS, postural orthostatic tachycardia syndrome, and went on to be diagnosed with Ehlers-Danlos syndrome, and then chronic fatigue syndrome, and gastroparesis with IBS, a frozen shoulder, and interstitial cystitis. And I'm only hitting the highlights, right? Now, I was diagnosed with hyperadrenergic POTS. My son was a fainter, and my daughter had a low level of POTS that almost went overlooked. Yet none of us responded to the traditional treatments for POTS. At that point, we felt that too much was getting overlooked in our cases, and perhaps if we looked hard enough at many subtle clues, we could figure out what was going on and reverse the process. We also refused to believe that all of our problems were purely anatomical, or that nothing could be done beyond symptomatic treatment, because like many of you, we were triggered to become ill. For us, it was viruses. For others, it's other infections or physical or emotional trauma. I thought if our bodies didn't respond normally to these infections or traumas, could we locate and treat our abnormal response and somehow return to the health we had before we were triggered, rather than just trying to treat the symptoms? And I know we're asking a lot. Well, we began studying these conditions and how they related to POTS 10 years ago, and began getting some answers about what's getting overlooked in many of us. We found that many patients suffered from abnormal intracranial pressure, vagus nerve problems, vascular abnormalities, inflammation, just for example. Some had activation of histamine-producing cells, immunological challenges, or autoimmunity. I strongly believe that unless we located and treated the underlying problems, many of us would never recover from POTS. Well, finally, the day is here. I am thrilled to announce that after 11 years of suffering and lots of research, we have opened POTS Care, dedicated to the evaluation and treatment of patients with idiopathic POTS. Idiopathic POTS, meaning POTS without a recognized neurological cause, like Parkinson's or ALS, for example, is what affected my kids and I, and can often be found in conjunction with Ehlers-Danlos syndrome or joint hypermobility syndrome, chronic Lyme disease, or chronic fatigue syndrome. This is a beast of a condition, I will not lie, but it is possible to recover, as my kids and I have done. At POTS Care, we use a team approach to compare notes and to locate answers. We're a small team of doctors and other healthcare professionals who approach the treatment of POTS not by treating the symptoms, but by searching for the underlying problems contributing to symptoms. This work is labor intensive, my friends, so we will only see up to 2 patients per week at POTS Care. And we'll have some questions for you to pre-qualify you as a patient. Please check us out at potscare.com. I think most of your questions can be answered there, but don't hesitate to call us if you have any more questions, okay? Honestly, this has been such a long journey that it's almost surreal to go from patient to practitioner. Now, if you or your children are on this journey, I want to tell you how sorry I am that you've had to suffer. This condition is not a fair one and often goes after the young, the best, and the brightest. We must stop treating this condition by treating only the symptoms. We must dig deeper, and so we shall. As always, my friends, let's continue to change our world one brain cell at a time if we have to. Gentle hugs to you all.